Hi, I'm Dr. Samantha, formerly known as Dr. B. I'm the face behind Walk the Natural Path. I am a naturopath that specializes in hormone health and fertility care. And today we are going to talk about preconception care and why it is so important to prepare your body for a pregnancy. So, a question I like to ask people: you prepare for a test, you train for a race, you prep and do a million things to get ready for a wedding, but why wouldn't you get ready for a pregnancy? This is something that I like to have people just kind of stop and ponder for a little bit. You are about to go on a journey to try to conceive a life. You're getting ready to grow a human inside of you, and that process can be very taxing. So why not prep ourselves to be in the best possible shape that we can be in order to have the healthiest pregnancy, healthiest baby, and healthiest delivery? Like the topics in my previous videos, this is not talked about enough. The value of preconception care. And in the beginning of this video, we're gonna start with why it's so important, and then we're gonna lead into tips and tricks on things you can do to actually prepare your body. Don't hesitate to leave a comment down below, ask me questions. I can't give particular medical advice on this channel. However, I can either point you in the right direction to either get some help, or I can take your comment or question as a video idea, and maybe I can answer some of your questions in a next video. Anyway, let's get started on preconception care. Why is it so important? So, as I said, if we have good preconception care and if we prep our bodies, we will have a healthier pregnancy, healthier baby, and healthy delivery. What does preconception care entail though, right? I believe that it includes diet and lifestyle. So, what you're eating, how much sleep you're getting, how stress is impacting your body. You know, the list can go on, but making sure that you're living a good balanced 80-20 rule, and then possibly getting some preventative labs done. Just a regular CBC, looking at like your red blood cells, your white blood cells, CMP, looking at liver and kidney levels, diving into even hormones. Now, you don't have to get all of those done. Sometimes I will encourage people to get those done if you happen to have an irregular cycle or a very intense cycle or no cycle at all, because those are things that we do want to be balanced going into this journey. Now, a lot of people will tell patients, or a lot of doctors will tell patients, let's not worry until 12 months into trying. I just don't understand why we shouldn't be preventative, right? Why can't we get ahead of that? The trying to conceive journey, the fertility journey alone is hard. It is not easy to wait 12 months to just start to do something about it then, right? So, you know, part of that preventative care and preconception care is addressing issues that are already present. So I just kind of talked about some labs. I would also want to see if there's a gut health issue. Is there a history of the family having hypothyroidism? Do you have hypothyroidism? And everything that I'm saying right now also goes towards both men and women. So I did say something about the cycle pertaining to hormones, but I still want to check for testosterone levels in dad, right? Especially if they have low libido or they're feeling very fatigued or moody lately. Those are things we want to address. So preconception care is not just about diet and lifestyle, although we're probably going to talk most about that later on in this video, but it is truly about prepping our system to be the most optimal it can be at time of conception. Because again, you're going to hear me say this a lot throughout this video, it's going to lead to the healthiest pregnancy, healthiest baby, and healthiest delivery. Okay, so let's get into some of the specifics. So what is the timeline on preconception care? When should you start this in this whole journey? I usually say at least 3 months. So it takes about 3 months for eggs to mature and for sperm to mature. It's basically the cycle of development of egg and sperm. So at least 3 months, because what we do for those 3 months are going to impact those maturing eggs, and those are going to impact the maturing sperm. We want at least 3 months. My ideal is actually probably starting 6 months before actively trying to conceive. There's a lot that could be going on, so I just like to give a big amount of time so someone isn't feeling anxious to start and I'm having to tell them like, hold off. Now, everyone's really different, so if you're struggling with something specific related to your cycle or your moods or your energy levels, we should definitely start 6 months ahead of time, right? If you feel really good and you just are working to prepare your body as best as you can, maybe 3 months is totally sufficient. But at least 3 months is the goal. Now, again, why is it so important? So I talked about healthy baby, healthy mom, healthy delivery. Let's get into the specifics, right? So the neural tube is really famous. It has to do with our B12 levels, right? People talk about how B12, we need to have enough methylfolate to make sure that neural tube is growing for a baby. Some things that people don't talk about is having enough choline. So that's going to be important too. But that's something people don't know unless you're someone trying to be proactive about preconception care and you're watching this video. So these are things that aren't told. And here's the kicker. The neural tube develops within the first 6 weeks of a pregnancy. Now, the first 6 weeks, I believe you are not seeing the OBGYN. You are not getting scans done. Most people don't even have blood drawn. So that is something that can 100% be missed. So if you weren't taking a prenatal before and you happened to be deficient in those nutrients, that could possibly cause an issue. Now, I'm not here to cause fear. I'm just here to educate, letting you know that you might have gotten pregnant and you didn't take a prenatal right away and baby could be totally fine. This is just something to, again, be preventative. Let's just get ahead of everything. So that's one example of why preconception care is so important. Okay, so when we're talking about preconception care, like I said, we kind of established a timeline. You're kind of understanding why it's important. I just gave one example, but there have been studies done that have shown specifically that those that struggled with infertility and then paused, worked on diet and lifestyle, and really focused on just the basics of living a healthy life, they were able to then move forward and conceive a healthy baby later on. So as I was talking before about that timeline, that 3 month, right? So it takes about 3 to 4 months for mature gametes to develop, those being the egg and the sperm. What impacts those? Your genetics do, your age does, and your environment does. And what is the thing that you can control? Your environment. As long as that there is a variable that we can control, we can do something to help improve or better those maturing eggs and sperm. So another reason why we're advocating for preconception care here, right? Or maybe just an emphasis on one of the reasons I talked about before. Let's get down to the basics of preconception care. So like I said, we're gonna start with diet and lifestyle. So nutrition support, sleep support, stress support, hormonal balance support, and then basic supplementation. Those are going to be our primary goals with preconception care. Let's start with nutrition. So for nutrition, having a whole foods-based diet, usually the Mediterranean diet is going to be my most recommended. It's best for overall. As you can see, the Mediterranean diet, so we're starting with fruits, veggies, fibrous fruits, legumes, basically our hearty foods, right? Then we'll see our fish and poultry and eggs and cheese, and then we're going to have our red meats and like sugars and things like that. The vices, so I feel like these are really apparent for most people, but these kind of go under also diet and nutrition, but then also environmental toxins. So it's kind of why I'm pairing all of this together right now. But alcohol, right? People ask me, how much alcohol should I not drink? And ultimately, none is probably the best answer, right? Like alcohol is a toxin. However, I understand the trying to conceive journey, like you never know how long it's going to be. So I don't want you to feel like you have to just stop living your life. However, none is going to be better than some because, again, it's a toxin. Ultimately, I'm always going to say wine over beer. I'm always going to say, a vodka sparkling water with lime or tequila soda water with lime. Those are going to be better than the mixed drinks with all the sugar. You can also just do mocktails. A big suggestion of mine, if you have a drink, just have a glass of water in between at least every drink, things like that. If you really need help with quitting alcohol, I recommend reaching out for support or help because it can be hard if you're used to that. And sometimes people don't realize how reliant they are on alcohol until it kind of comes time to slow down drinking it. There's also great companies like Dry Farms, which they still have alcohol in their wine, but it's a lot lower sugar. It's a lot lower alcohol percentage. And I do also have a code to get percentage off of that for you guys. So I'll put that down below as well. I did like their wine. I think it's good. I've tried it myself. Then there's going to be caffeine. People talk about caffeine all of the time. What I'm going to say, keep it under 200 milligrams. Make sure it's a good organic coffee that's been third-party tested for mold. If you can't find one that's third-party tested for mold, just go for organic. But with the coffee too, I would honestly say that I think people get really stressed about it. It's more about the timing. One, make sure coffee doesn't make you more anxious. 2, try to just eat breakfast before you actually drink the coffee. And then like everything, like quality matters a lot. And then just don't drink an obscene amount of it. 200 milligrams of coffee is usually about 2 8-ounce cups of coffee, not like 2 of those giant cups of coffee. Other things that we don't want any of: nicotine, no tobacco, no marijuana. So all of these have been shown to definitely impact sperm levels, but then also impact the actual genetic component of egg and sperm. So this is going to be something really important to leave. I actually work with a lot of people to help quit these substances. So if you need help, you don't have to find it through me, but find it through someone, because it is, like I said, can be harder than most people think. I did separate the nicotine from tobacco because a lot of people are doing like the Juuls and things now, and they think it's not as bad. It's still going to be impacting sperm quality or egg quality for sure. We kind of talked about environmental toxins. I kind of moved through that really quick. There's going to be a lot of information in this description below, so just check all of that stuff out. There's a lot of good guides that can help you get through all of this. I even have an eliminating environmental toxins blog out there, so you can 100% check those out. But we're going to move on to stress. We know that it impacts fertility. We understand that. How to work on it. Different types of therapy I love. Obviously talk therapy is good, but I'm a huge fan of actually more of the somatic therapies. I love biofeedback. I love brain spotting, EMDR, hypnotherapy. I highly recommend trying those out. I think they're very beneficial on top of doing all the little things. One of my biggest recommendations is to do your stress reducing tasks every day, whether you feel stressed or not, because then 1, you're in a habit of it, and 2, you'll slowly notice that you get stressed out less and less, and you don't have to rely on those tasks as much as a crutch to stop you from stressing, but more as a maintenance task, right? Again, preventative care. So really focus on that. I do think there's amazing adaptogenic herbs out there, but I do believe that there's a right herb for every person, and that can change. And so ultimately, I always recommend finding a practitioner to work closely with when it comes to dosing herbs and things like that to help reduce stress. I want to stress that stress is something that we need to focus on. I don't want you to feel lost in that, so find support where you can, and make sure that you honor yourself and take care of yourself, because a lot of times I feel that people are stressed just because they just haven't allowed themselves to actually relax or do things that they enjoy. Honestly, I don't know how I didn't put this one first, but sleep is going to be a big deal when it comes to sleep. I used to tell people between 7 and 8 hours. I almost laugh at that now because everyone's so different, and I feel like the range is actually from like 6 to 10. Some people feel really great and well rested on 6 hours, and other people need a lot more sleep than that. So for example, I am one of those people. I need like from 8 to 9.5 hours of sleep, and I feel so good. I feel awesome. My husband, on the other hand, if he sleeps that much, he almost oversleeps and becomes very tired and lethargic throughout the day. But if he gets a good like 7 hours, he feels perfect. So one, I like to say everyone has their sleep sweet spot. So you can look to evaluate that for yourself. Sleep a couple different hours and see where you feel the best. Obviously, there will be some other factors that play a role, so you might have to do this a couple times. However, make sure you are getting enough sleep. If you are not waking up well rested, first I have people check for their sleep, then we kind of check other things like thyroid, adrenal function, gut health, hormone balance, and so on. But make sure that you are waking up feeling rested. Your caffeine should not be a crutch. Your caffeine should maybe just be something that you enjoy, or maybe a little pick-me-up, but you should 100% be able to go throughout your day without coffee. That's actually usually a red flag to me that we need to heal something else if someone's like, I do not start my day until I have coffee. So some food for thought there. So sleep's gonna be really important. I honestly think it almost comes above anything else. And so make sure you're getting good night's sleep. Movement. So movement's a big one. I tell people I want at least 30 minutes of movement a day. This can be walking, dancing, cleaning, etc., etc. Like literally can be almost anything. However, it is different than exercise, which I still want that done at least 2 to 3 times a week. Exercise includes the weightlifting, maybe a HIIT workout, running, hiking, all of that kind of stuff. So I want something basically that gets your heart rate up. People ask about what type of movement is best in fertility. I actually might make an entire video off that because I feel like it's a question that I get asked all of the time. But essentially, do what feels good for you. Everyone's body is going to feel different and more optimal in a different space, right? Like some people can train for a marathon and all of a sudden have the most regular period of their life, and some people can train for a marathon and completely lose their period. Everyone is so different, so you have to really gauge it to you. But movement is going to also be key. And last but not least for today's video, the supplements. So I'm not gonna, like I said, this is no medical advice and I don't want to give you too much, but I do want to tell people that while they're on their preconception care journey, they should start taking their supplements before they're actually actively trying to conceive. So again, about 2 to 3 months before, I want this to start happening. Big ones is going to be a prenatal, a fish oil, and a probiotic. I actually have all my favorites listed also below, so you can click on that and get 15% off those supplements. Those are my favorite recs. Make sure though you check with a practitioner before taking them with other medications. Make sure that you look at the back, that you have no allergies to those. But I do really suggest doing that, specifically the prenatal, to get, you know, all of the right micronutrients like the choline I talked about before in this video. In summary, that was kind of a lot of information, but preconception care is really important. Start it sooner rather than later. You will give your body the best chance for a healthy pregnancy, a healthy baby, and a healthy delivery. I hope you all enjoyed this video so much. If you liked it, please don't forget to give it the thumbs up, hit the subscribe button, turn on those notifications. I do release a video every Friday, and I hope you all have a beautiful day.